My name is Dr. Sam Sidney. I'm a fellowship-trained orthopedic surgeon that has had the benefit of being associated with Orthopedic Associates of Central Maryland for over the past 25 years. What does fellowship training mean? It means that after residency, I spent a year doing just joint replacement arthroplasty. I had the benefit of working with a wonderful surgeon in Columbus, Ohio. Since then, I have been in the Baltimore, Howard County area performing joint replacements through many different approaches. This video, we're going to focus on the indications of hip replacement, but focusing on anterior hip replacement done through an anterior approach using a HANA table. What are the indications for hip replacement? A lot of times, pain is the first indication, but sometimes pain can be deceiving. It might not always be what you think is hip pain. So a diagnosis needs to be made. Oftentimes, that's by a thorough physical exam, and then x-rays, or sometimes an MRI. Now, just because you have hip arthritis does not mean you need to have a hip replacement. An assumption is being made here that you have failed all conservative measures. That means physical therapy, pain medications, possibly injections, and restriction of activities. So let's get on with the discussion of hip replacement. A hip replacement is an operation performed where the diseased hip joint, that is a ball and socket joint, are replaced with artificial surfaces, sometimes metal on plastic or sometimes ceramic on plastic. This operation has been performed through many different approaches. And if you've seen incisions, sometimes you see a long incision in the back of the hip, sometimes the side of the hip. Today we'll be discussing the advantages of an anterior hip replacement. The procedure of an anterior hip replacement using a HANA table requires the use of a specialized table, making an incision in the front of the hip. Once that incision is made, the interval between these two muscles is identified and these muscles are separated. For purpose of demonstration, I'm going to take these muscles out of our view. A second set of muscles are identified, separated, and then we can work on the hip. The HANA table is valuable because it allows us to rotate the extremity to gain access to both the socket as well as the femur. I'm going to take a slightly different tact on discussing your recovery. I think your recovery actually begins the moment you decide you need a hip replacement. I think you need to get ready mentally, physically, and spiritually. How do you get ready mentally? You have to understand the diagnosis, and I oftentimes recommend bringing a second pair of ears with you to the office visit, because that way appropriate questions and a greater understanding can be gained. What can you do physically? A lot of times we do what's called prehab, sometimes going to therapy or a gym beforehand to get yourself in the best shape possible. Another aspect of getting ready for your rehabilitation is a preoperative class. This is a class that's usually held at the hospital, which lasts about an hour and a half, where a lot of information is imparted. And then the operation. The goal of the operation is to get you up that very day. Now, with the uniqueness of an anterior hip, getting up means not having a lot of do's and don'ts, but just doing it safely with the help of a physical therapist. And then once you're safe, we essentially let you start going and starting your rehab at your own pace, guided by physical therapy. What are the risks and benefit of anterior hip replacement? Let's talk about the risks quickly. With any operation, there's the risk of infection. This can be prevented by steps taken beforehand, during, and after surgery. Another risk is the possibility of a blood clot. Let your doctor know if you have had prior blood clots, and we take measures by early mobilization, some mechanical methods that would employ devices that would squeeze your legs, and also early mobilization, and sometimes the use of medications. Another risk is fracture. This occurs rarely, and there once again, experience counts. If it does occur, it has to be recognized and treated accordingly, and sometimes, very rarely, it means restricting your activity until that fracture heals. Another complication is numbness on the side of the thigh. This is something that is unique with an anterior hip replacement because some of the skin nerves, that means the nerves that supply sensation and not control your muscles, can be either stretched or cut. This is, when it does occur, a temporary and oftentimes a symptom that'll go away over time. What we've discussed sounds painful, doesn't it? Let's discuss pain management after surgery. Most of these procedures are done with a regional. That means a saddle block where you're numb from the waist down. This allows pain to be controlled for some hours after surgery. During the operation, one of the new innovations is the use of a medication that extends pain relief for about 48 to 72 hours. This has lessened the need for narcotic pain medications and allows you to get up fairly pain-free after surgery. Notice I used fairly pain-free as opposed to absence of pain. Our goal is to have your pain under control and not pain-free. By this I mean we want to make sure that you're able to function well, and sometimes if our goal is absence of pain, you really won't be able to participate in safely getting in and out of bed. In summary, we have discussed hip arthritis and anterior hip replacement. I have performed thousands of these, and I look forward to sharing my experience with you if the need arises.